I'm Simon Riley-Fuller, I'm Head of Nursing for Adult Critical Care here at Leeds. I really wanted to introduce Pets as Therapy volunteers for a number of reasons, but we want to do something that would really benefit our patients and also our staff. So it's been a really good thing to introduce. Ordinarily you wouldn't imagine critical care being an area that you would necessarily introduce a dog. But we have different levels of care for patients. We also really want to do it for a lot of the relatives, so a lot of the long waiting times and just generally hanging around on the units can be by relatives, and we wanted to do something for them that would actually lift their spirits a little bit.
Hi, my name is Sarah, and this is Maggie, my Pets as Therapy dog. She's 18 months old and she's a cockapoo. So I became a Pets as Therapy volunteer because I've always wanted to do something with animals, and I wanted to make a difference to people directly, and to be able to come in and just make a difference to somebody's day or somebody's week, or maybe somebody's outlook, and give them an inspiration to work that bit harder to recover and to be able to go home and see their own dog. Meant that it really inspired me to come and do this volunteer role and make a difference. ICU is, to me, is one of the hearts of the hospital. So it's with the poorest patients and the most challenging environment. So we come and see the staff almost as much as the patients, because the staff have a very challenging job, and to make a difference to their day, to give them the inspiration to work through the day and through their long shifts, and also the patients that probably need a bit of a pick-me-up from the really stressful, challenging time they're going through. We come every week on a Wednesday, and we spend an hour visiting the critical care wards on either LGI or St James's alternately every week. So to start with, we came for a visit around just to get to know the area, and for Maggie to become used to the sounds and the smells, because it's quite a different experience coming into a hospital than it is anywhere else we would go. But over the weeks we've really got used to the layout and the noises and the smells and the people, and we've settled in very nicely. So somewhere that's made a real difference is there's a patient that we've seen over the last 3 visits. So he's been in ICU for 5 weeks, and to start with he was unable to move and to respond and unable to speak, but I discovered that he had a dog at home that he was really missing, and over the last few weeks we've visited him. Maggie started to recognise him, he's been telling us about his dog, and I think it's given him the inspiration to get himself as mobile as he can and to be able to go home as quickly as he can.
One of the things to help introduce Maggie the way that we have is to have a set time that she comes in once a week at a certain time, and staff know when to expect her. It can be quite a pressurised, chaotic environment, so the staff know when to expect her. And it's also really good for certain types of patients and relatives that we can actually signpost Maggie to them and know the times of the day, times of the weeks that she'll actually be in. Obviously, because Maggie is a dog, it was quite a different thing to introduce her into all the units, but a lot of hard work has gone in by myself and trying to set this up with Sarah, but also from James Evans, who's one of the matrons, has been really good in introducing Maggie to the units, to the matrons, to all the ward and unit staff, acknowledging that not everybody is a fan of dogs, but trying to recognise and introduce the benefits it does have to our patients. We've done a lot around, we have a CSU Facebook page, we've made some posters through patient experience, highlighting who Maggie is, and who they can contact if they want any more information. But we've done it quite slowly to try and integrate her so that she's accepted, and now she needs no introduction, she's just Maggie.
So the feedback from staff and patients has been great. The feedback from staff say it's their favourite of the week. The staff want to work on a Wednesday shift so that they can see us and just have a cuddle. And from the relatives, sometimes more than the patients, with the relatives just say that it's really made their day, and the patients say they've been looking forward to seeing her all day. So I think it's just nice to bring a smile to everybody's face, and I think it's a distraction from the daily struggles, and it makes a nice change.
Just seeing what Maggie has done has actually been fantastic already. I'd also like to say that the staff have loved it, and it's been one of the best things that we've done for the morale of all the nurses on the units, the doctors, the AHPs. It's been absolutely phenomenal, the morale that she's had on the units.